Members of the US Senate grilled Robert Kennedy Jr. over his views on vaccines and other health issues. Mr. Kennedy's President Trump's pick to run the Department of Health and Human Services. It's a sprawling agency, including FDA, Food and Drug Administration, Public Health, CDC, onwards and upwards. The Democrat Ron Wyden asked Kennedy about some of his more controversial opinions, linking them to a deadly measles outbreak in Samoa.
The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS Secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Dr. Ranney is joining me now. She's an emergency physician and Dean of Yale's School of Public Health. Doctor, good to see you. I suspect one needed an aspirin or two after that hearing. It was so contentious, and maybe just a strong drink would have done. Look, the reality is no new ground was found in that. And at the same time, Mr. Kennedy is still trying to say he is misunderstood and all he wants is fairness on vaccines and these other health issues.
So I think you would be hard-pressed to find an American who doesn't want America to be healthy. The debate here is about what it takes to make America healthy. We have a long history in public health of putting interventions in place that have lengthened life expectancy and have made Americans healthier. Things like vaccines, about which the science is tremendously clear. They are safe and effective, and they work, and they save lives and protect people from illness. Things like food and water safety, pharmaceutical or drug safety, and things like child injury prevention, mental health support, and so on. The trouble here, of course, is that RFK Jr. didn't clear up any of the controversies about some of his earlier statements compared to what he would do as HHS Secretary during this hearing. I don't think it left us with much more information than we knew earlier today.
Right, but at one point, one of the senators said, I know on the Republican side, there are 3 doctors on this committee, and I am a chemical engineer, a chemical scientist, and I find your views based on science. And based on science, they are refreshing. Now, I'm qualified in many things, but I am not qualified to know what the right answer is here when you've got senators saying, look, I'm a doctor and chemical scientist, and I think, Mr. Kennedy, you're right. You're fair, you're honest, you're decent.
There are some things he is right about. We are seeing increasing rates of obesity and mental health problems, but he confuses correlation and causation. Correlation is the idea that you look at 2 things that are happening at the same time, right? And know that they just are happening together. They don't cause each other. For example, we eat more ice cream in the summer and more people get sunburns or drown, unfortunately, in the summer. They happen together. It doesn't mean that ice cream causes sunburns or ice cream causes drownings. So good science is able to disentangle the 2. There are parts of what RFK Jr. that is saying that are absolutely true, that we have medical and public health problems that we need to confront. The trouble is that he sometimes assigns the wrong thing as the cause.
Do you sometimes think, though, it's all a bit depressing, these hearings, because nothing's going to change? I mean, particularly, you know, the 2 confirmations that one sees, the Hegseth and this one, doesn't appear that anybody's going to budge from their preordained political positions, at least at the moment.
You know, I am not a politician and certainly can't weigh in on how people are going to vote. What I do know is that this agency touches the lives of every American. It is $1.6 trillion of our U.S. budget. And I hope that our senators are going to vote for someone who has both the policy expertise as well as the belief in science that is needed to run something that literally touches all of us.
So if you pull it all together, how are you looking at the next 4 years? Because I mean, I don't know whether he's going to be confirmed, but I'm guessing if I was a betting man, I'd say he will be confirmed, notwithstanding, by the way, his own cousin's description of him as a predator and a pervert, but that's another matter for a discussion in another forum. But it does look like he's going to get it. Does that worry you?
I think, like with many things that are going on right now, it is really difficult. I'm going to quote your prior guest, actually, who says it is impossible to predict what's going to happen later today, much less tomorrow. I think there's been tremendous bipartisan support for NIH for a very long time. There's a deep understanding that we need to keep leaning in to help reduce obesity. I am worried about mis and disinformation about vaccines and about infectious diseases as we're facing a potential H5N1 bird flu pandemic in the United States.
Yes.
We're facing growing rates of global spread of disease, and we've just pulled out of the World Health Organization. I have a lot of worries about what's going to happen next, regardless of whether he gets confirmed.
Do you prefer ibuprofen or aspirin for these moments like this?
But hey, at least you know there's a difference, which is more than many people do.
Oh.
Don't give your kids aspirin, please.
Thank you very much. Listen, I'm of the firm view, if one's good, two must be better. So I'm not wanting to take anything. Good to see you.
Talk to your doctor first.
Good to see you, Doctor. Thank you very much indeed.
Take care, Richard.